Chapter 17, Nursing Diagnosis. Nurses continuously collect data. The nurse constantly observes, interacts, and applies physical examination techniques to gather information about a patient's condition. A nursing diagnosis is made when a nurse identifies a health-related problem or the potential to develop a problem based on patient data. Nursing diagnosis is the second step of the nursing process. Case study. Do you have a situation in your life that caused you to consider nursing? How will it affect your ability to provide nursing care? John here is a first semester nursing student who is particularly interested in heart disease since his father died of a heart attack at age 48. John decided to go into nursing because of his father's death. He wanted to select a career that improves people's lives. John is studying the steps of the nursing process. He knows this information will help him care for cardiac patients in the future. Types of nursing diagnosis. Problem-focused. Identifies an undesirable human response to existing problems or concerns of a patient. Risk diagnosis. Diagnoses that apply when there is an increased potential or vulnerability for a patient to develop a problem or complication. Health promotion. Identify the desire or motivation to improve health status through a positive behavioral change. John is reviewing the phases of the nursing process and attempts to put them in the correct order. What is the correct order of the nursing process? Use the nursing diagnostic process to accurately identify a patient's nursing diagnosis. You need critical thinking, knowledge, experience, attitudes, and intellectual standards. Here is a flowchart of how we apply the nursing process and our assessment data to come up with a nursing diagnosis. Data clustering. A data cluster is a set of cues, the signs or symptoms gathered during assessment. Data clusters are compared with standards to reach a conclusion about a patient's response to a health problem. Each clinical criterion is an objective or subjective sign, symptom, or risk factor that, when analyzed with other criteria, leads to a diagnostic conclusion. In this part of the case study, I want you to think about, why did John correct Beth? So how do we formulate a nursing diagnosis statement? Well, we need to identify the correct diagnostic label with associated defining characteristics or risk factors and a related factor. A related factor allows you to individualize a nursing diagnosis for a specific patient. And here's a flowchart that helps you a little bit. So we need to formulate a nursing diagnosis statement. Most settings use a two-part format in labeling health promotion and problem-focused nursing diagnosis. Some agencies prefer a three-part nursing diagnostic label. So John is trying to remember the 4 types of nursing diagnosis, and he asks Beth because he knows Beth understands it. Does Beth agree with John? If not, why? Sources of diagnostic error. So these are errors that can occur during data collection, clustering, analysis and interpretation of the data, the diagnostic statement. So we need guidelines to reduce diagnostic errors. So concept mapping is one way to do which of the following? So once you identify a patient's nursing diagnosis or diagnoses, you enter them either on the written plan of care or in the electronic health information record of the agency. Computers help organize data into cluster and enhance our ability to select accurate diagnoses. When initiating an original care plan, place the highest priority nursing diagnosis first. By learning to make accurate nursing diagnoses, your care plan will help communicate the patient's healthcare problems to other professionals. A nursing diagnosis will ensure that you select relevant and appropriate nursing interventions for the client.